No further ado, I would like to introduce Catherine Song of Soundable Health. She'll be talking to us about how ambient sounds can tell us about our health. So please welcome Catherine.
Yeah, hello everyone. I'm Catherine Song, and founder and CEO of Soundable Health. Well, so far, most of the AI ML DL technology in the healthcare sector have dealt with some image text and recently some voice and dialogues. But we are dealing with sound, ambient sounds, non-verbal sounds around us. Yeah, so great pleasure to be here. And today I'd like to share 4 applications using ambient sound around us to learn more about our health and to help physicians. So 2.5 years ago, I've started for the urinary health. So the urological conditions, including the enlarged prostate, overactive bladder, and the chronic cystitis, we have more than 30-40 million of the patients in the state alone, including my mom and co-founders. They're suffering from the major symptoms are the weak urine stream and frequent urination, 10 to 20 times a day, and the strong urge out of control, or some they're very hesitate to start urination. But all the symptoms, as you guess, it's very subjective, very subtle, hard to describe, hard to identify, recognize their symptoms. That's why they spend 4 to 7 years to seek a proper treatment from the onset of the symptoms. But during the time, all the symptoms are developing to the severe bladder and kidney disease. Yeah. So all the symptoms are subject and the subtle. They suffer from the lack of awareness of the symptoms and conditions. And the most of the patients I've met would never enjoy the experience to describe in detail, every detail about their symptoms suffer from, because the urinating is a very private thing for everybody. So they feel very reluctant to talk about their symptoms, even to their family or the physicians. And very different from the hypertensive or the diabetes, there is no tool to track the symptoms in a quantified clinical grade longitudinal data or the form. So that leads patients and physicians to the long, winding history check and conversation session again and again for every visit. So if they have a good at-home quick monitor to track the symptom in a quantified manner, then they can make a better, more engaging or care plan with a full daily picture with the clinical grade parameters. Of course, there are current standard diagnostic tool for the area to evaluate the urinary functions. The uroflowmetry on the left side is a weight scale-based weird toilet at urology practice. Well, it's only available at the office and with a very limited level of efficacy. And the right side, that's a voiding diary, another standard diagnostic tool. To keep the voiding diary as guided, we need to pee to the measure cup and check the readings and write everything on the paper for 4 days. So it's really cumbersome, and as you easily guess, it has a very low adherence, 30-40%, less than that. Yeah. So what I've been making is a mobile app with no additional hardware, using the smartphone microphone on your iPhone and Android phone. It records bathroom sound while we are urinating at the bathroom over there. And the AI ML, or the deep learning things, analyze all the acoustic features and acoustic signals and give you clinical grade speed, volume, and the frequency, and the voiding time things. It's clinically validated, through the multiple clinical trials in academic medical centers and peer-reviewed literatures. We are the FDA-approved Class 2 medical device, also a mobile medical app. So we launched our open beta in last May. So you can download the application. It's free at the App Store and the Google Play Store for your own health management at home. So we have now more than 1,200 users, including the 100 urogynecologists and urologists. And it's really simple and super easy to use. It's proven by we have more than 10, 20 the users in their 70s. They use the application very well with no learning curve. But this is a result. The upper one is for the normal, and the lower one is for the normal people. So from the acoustic, the audio signal captured by the microphone, the smartphone, we analyze it. The key acoustic features can accurately infer the key aerodynamic parameters. And the simple triage algorithm, say you look okay, or you need to see the urologist right now things. It can be also integrated in the EMR for better clinical decision support. We are expanding to our technology to the respiratory area using the cough, breath, and the lung sound. So that each cough sound has very distinctive sound features like dry, wet, clean, consecutive, or explosive, or whatever, or with a special weird tune. So we can capture that every acoustic features and sounds accurately. So count the number of coughing during the period of time, capture the on the smart microphone, and can simply classify into the multiple categories according to the indications, for example, postnasal drip or COPD, asthma, pneumonia, or whatever. Yeah. We are doing the clinical studies, multi-center studies in South Korea. And the last application is about lung sound captured by digital stethoscope, not yet from the sound, the smartphone. So it's a great example. Usually primary care physician and pulmonologist capture the sound using the stethoscope, but likewise to the urologic the symptoms, well, it's very subjective. So the physician A and B are listening to the same sound on the same patients, but they leave a different note about that or the symptoms. In that case, the algorithms can help them, but it can be a good suggestion or the estimate about the symptom in a quantified, in a better resolution form. Yeah. It also can be used for the follow-up study. So he's one of our participants in our study. Yeah, he got much better at his follow-up visit. So all the numbers at all the listening points, the number of the cracking sounds due to the COPD are reduced. We can check that in a quantified manner. That's it for today. So I'm happy to meet you. We have a small booth over there below the restroom signs over there. How thoughtful the conference host is and they. So happy to meet you and have any questions. Thank you very much. Any question? Yeah.
Has anyone tried to submit a question on this? You did. You tried, but
Can I just ask it now?
Please.
Have you tried using other information than just sound? I don't know, like with cough, vibration patterns. I don't know how the body shakes when a person coughs. Maybe that would be additional information that would help.
They're purely using the sound, and we are trying to consolidate all the other clinical information and self-report. But to get the clinical primary, we only use sounds. Thank you.